I would like to request our friends from Australia, because it's too late for them to give their talks. So I would like them to give their talks first. Dr. Graeme Pollock, who's going to be talking about status of corneal surgery in Australia.
Thank you very much. I'll just share my screen here. Okay, good evening, everybody. When people are probably getting sick and tired of me talking about, when I talk about iBanking and COVID-19, I keep talking about risks and relative risks and risk-benefit ratios here. And so as I go through this talk, largely I'm referring to the management of risk, both within the iBank that's being undertaken in Australia, but also the management of risk through our public health measures in Australia as well, which you'll see have quite a significant effect on the risk that we actually see at the iBank interface. And then go on and talk about the risk intervention consequences or outcomes of that, both from our own management of risk within the iBank, but also the public health interventions. And more recently, some activities that are occurring in some of the hotspots that we're now seeing in Australia. I think that we certainly have to put things very, very much in perspective here, that what we're talking about is certainly a possibility of transmissibility of the virus. In fact, every indication is that the virus cannot be transmitted by any form of transplantation. And indeed, there was never any evidence of transmission of MERS or SARS by any form of transplantation, or indeed blood transfusion as well. And as someone referred to before, we've also seen the absence of the virus in corneal tissues that have been obtained from COVID-positive postmortem donors. In Australia, the donor selection then has really looked at excluding donors who have symptoms of SARS, or if they of the virus, sorry, of COVID-19, or if they've had close contact with a person confirmed to have COVID-19. And we're looking at a 28-day exclusion period in Australia for that. This is very similar to the blood banks screening. For donor testing, in Australia, it's not recommended at all for screening donors. And this is because we have very, very much concerns about the validity and the reliability of the test, whether it in fact relates to infectivity, and also, of course, the lower incidence that you have of the virus in your demographic, the lower predictive value of it. And you'll see that's quite relevant to the Australian situation. Tissue processing. Making absolutely sure, and this is something that happens routinely anyway in all the iBanks in Australia, that at some stage, whether it's at retrieval, if it's an in situ retrieval, or indeed whole globes being rinsed with povidone iodine after retrieval, we certainly know that povidone iodine inactivates the virus, even at a very low percent of 0.23%. And in fact, the European Council for Disease Control considers this a validated disinfection step for enveloped viruses. One of the most important things, though, that we have in the iBank is an emphasis on PPE for our staff. In fact, the greatest risk that we have here is not risk that the cornea will transmit COVID-19. The greatest risk we have here is that we will infect our iBank staff during retrievals. And certainly if we have one staff member who contracts COVID-19, that essentially shuts down the iBank. One of the things where we have a very low risk is because of the public health response that we've had in Australia. The public health response has been very effective, and in most states of Australia, one would consider Australia to be essentially COVID-free now. Those figures that you see on the side here, the 100s and the 200s, they're not 200,000, they are 200. So a very, very low incidence of COVID-19 in Australia. Although more recently we have seen a second wave, but I'll have a little chat about that. A little bit further on. One of the consequences, though, and one of the parts of the public health response to this was to prepare for a surge of cases. And so elective surgery in Australia for a month or so, right across Australia, was shut down. In regards to corneal transplantation, it meant what we call Category 3 or Category 2 corneal transplants, that either routine corneal transplants or transplants for bullous are essentially stopped and ceased. And so that certainly, if we have a look at our figures of transplant activity and also donor activity from March through to June, you can see that during the health system contingency planning, the surge capacity, I think there was an anticipation that elective surgery was going to be ceased, and so there was a little bit of a rush to get surgery done before these transplants were, these electives were cancelled. Once we'd cancelled all the elective surgery, you can see that the figures dropped to about 51% of our past activity level in 2019. Although this wasn't seen across, that's an average figure for all of Australia. It varied across Australia depending on what state you're in. At the same time, of course, we saw a decrease in donation rates. A lot of that was self-regulated by the eye banks because they didn't have the need. Come May, when there was a gradual reintroduction of elective surgery, you can see that we got a surge again of transplants, and these were actually cases that were being done that were missed during their previous time when elective surgery ceased. Although what we also have seen is a drop in donation, and I'll have a little chat about that a little bit in a moment. As you can see, both the donor activity and the transplant activity was not equally felt across all the states of Australia. And in fact, in Western Australia, for instance, really there's been very little impact of COVID-19 on their rates at all now. Now, I spoke about the second wave before, and most of that second wave that you see in these figures in Australia are in fact the Melbourne metropolitan area, which is where I'm actually broadcasting from right at the moment. In Western Australia, South Australia, Queensland, and New South Wales, the number of COVID-19 cases per day you can count on one hand. In Victoria, though, we're surging at around about an average of around 400 to 700 cases a day for the past week. And that's had an interesting effect on the activity within Victoria. These are the Victorian figures out of my own eye bank. You can see that, again, back in June when the lockdown ended, we had a surge of cases, scheduled cases being done. In July, though, we began to see patients self-cancelling themselves. There also the requirement for patients to be tested for COVID-19 before they came in for surgery also contributed to a lot of self-cancellation of cases. And so, but by the end of this month, we've also seen electives shut down. The donor activity is interesting because, as I said before, back in March and April, a lot of the donor activity was a wind down on the eye bank's behalf of actually deliberately reducing donor rates. In May, when the hospital activity was very slow because most electives were still not happening, but we had essentially probably excess staff within the hospitals during that period waiting for the surge that didn't come. we actually saw our referrals increase and our donors increase. But in the past 2 months, with both the electives coming back online and the hospital activity being increased, but now with the electives down again, and we've actually seen a reduction in referrals. But more concerningly, we've also seen a reduction in the consents that we're getting. And this is because this second phase has taken a different mood amongst the community. The first wave that came through, there was certainly a sense of shared community values here, but as the second wave has come through, our social capital, the social temperature has certainly dropped. Death and bereavement are complicated enough, but in the face of COVID going on at the moment with limited bedside visits, the bereavement is also different, and there's a lot of fear and anxiety out there at the moment. And it's actually leading to less consents being seen, and also less referrals of cases coming through. And as we go into late July now and August, in Melbourne, we're actually having hospital staff redeployed to other areas, in particular the aged care sector, out of acute care hospitals, because that's where the COVID is largely occurring. And so a lot of our referral programs for that reason are breaking down, as well as our consents breaking down as well. And we're likely to see more of that in July and August. The second wave, I would warn, seems to have very much a poor effect on social capital. As soon as your social capital drops, then your donation rate also drops. And I think that's probably a reminder that what we do is a very human thing. That donation is a very human thing, and as soon as some of those things get complicated and the feel of the community changes, then that affects what we do as well. Thanks very much for your time.